Assalamu alaikum. I am Dr. Abdulaziz Yusuf. Welcome to today's lecture on our hospital policies and procedures for external transfer or referral. Today we will discuss the process for requesting intensive care unit beds between health levels. Question number 1. The treating doctor has identified the need for an ICU bed for a critical patient. What should be the doctor's next step according to the procedures outlined? A. Prepare a medical report and send it directly to the Health Clusters Coordination Department. B. Request an ICU bed from the hospital's ICU department using an internal form. C. Contact regional hospitals directly to inquire about bed availability. D. Arrange for emergency transport to another hospital. The correct answer is B. When a treating doctor decides a patient needs an ICU bed, the first step is to request an ICU bed from their hospital's ICU department using the internal form. This step involves detailing the case type and the diagnosis. If an ICU bed is not available at the doctor's hospital, they must prepare a detailed medical report stating the referral reason. This report, along with required attachments like transfer form, patient information, a declaration of ICU bed unavailability, also an ID copy and a service purchase form is then submitted to the hospital's medical referrals coordinator department. Question 2. The treating doctor has identified the need for an ICU bed for a critical patient. After receiving the medical report and the necessary documents from the treating doctor, what should the medical referrals coordinator department of the referring hospital do next? A. Directly transfer the patient to the nearest hospital with an available ICU bed. B. Verify document accuracy, scan them in format 54M and use the allocation system for bed request. C. Wait for the patient's condition to improve before proceeding. D. Inform the Health Clusters Coordination Department about the case. The correct answer is B. So the Medical Referrals Coordinator Department is responsible for verifying the accuracy and the completeness of the documents submitted by the referring doctor. After verification, the documents are scanned in format 54M. The department then uses a Halati electronic transfer system to select the case type and bed type. Case type like emergency, bed type like ICU, filling in the required data accurately based on the medical report. The scanned documents are then attached and the request is then sent to the regional hospitals, and the cluster coordination department is informed about the referral number. Question 3. Upon receiving an ICU bed request from another hospital, what is the first action that the medical coordinator at the receiving hospital must take? A. Immediately prepare an ICU bed for the incoming patient. B. Deliver the printed request to the specialist doctor and follow up for a response. C. Notify the emergency department to expect the patient. D. Confirm the transfer through a Halati program. The correct answer is B. So the first action of the medical coordinator at the receiving hospital is to print the received request and deliver it to the specialist doctor. The coordinator is responsible for follow-up with the specialist to obtain a response to the request within a maximum of 3 hours. Upon case acceptance, details like the bed number, reservation duration, and the responding doctor's information are attached. Additionally, the medical coordinator oversees the patient's arrival and resolves any obstacles, ensuring all procedures for the accompanying staff are completed. Thank you for joining us. Stay tuned for more policy reviews.